The PFAC is a fantastic example of the truth that everyone's voice matters when it comes to healthcare. PFAC stands for Patient and Family Advisory Councils, and that's a group of current and former patients, family members, caregivers, who are working to improve the health care environment.
I always thought my voice was small, but because of PFAC, it's grown bigger and bigger and bigger.
I think it's important for patients to have a voice because they have such a short time with their physicians that if they aren't vocal initially on what is wrong or what they're feeling, then it's harder for the doctors to discover this, to get into the partnership with us. That's what's most important. So if some people can't do that, they have us. And that's our whole idea. We're the voice for the patient.
One of the incredible benefits of having a PFAC is that it helps to really build trust between our medical center and our community. It's an opportunity for transparency, for collaboration, and I think everyone being in the room and equally valuing each other's expertise really helps us build trust across both sides.
Trust is central to the healthcare experience, and if people don't feel heard or they don't feel that their needs are being seriously attended to, they're not going to fully engage in their own treatment or care.
There's also mistrust sometimes from the community, like what's really going on in the hospital. Do they have our best interest at heart? So what the PFAC does is, yes, they actually spend lots of hours actually talking about what's going on in the community, what's coming from the patient comments, what they're hearing from their patients. And then that starts to, kind of click also with them. We're like, wow, we didn't realize that, our voice is just as important. It's not just about the doctors or the nurses.
The most successful, the best, the highest quality healthcare comes from the collaboration between our medical experts, our staff, our providers, our leaders, and the lived experience experts, our patients, their loved ones, their care partners.
The more that patients and their family members understand the caregiving process and what's happening, and when they're empowered to speak up, that results in better health outcomes.
If you're starting a project, you need IT involved, you need this, the PFAS should be one of the first things you're thinking about because, again, the patient is at the center.
And I don't care how big a hospital is or how small, you can all have an impact.